Bismillahirrahmanirrahim. We will talk shortly about a very new subject that's called EVLA procedure. EVLA procedure, this is abbreviation for endovascular laser ablation. Endovascular laser ablation for of the great saphenous, incompetent great saphenous at cases of axial varicoses of the lower limb. This procedure is done by ultrasound guidance, totally under ultrasound guidance. It's non-complicated procedure. It's a simple procedure, but with some precautions. What we do usually at the EVLA procedure, the patient is under spinal anesthesia. Then we start to after confirmation by duplex exam, thorough duplex exam, that we have incompetent great saphenous vein, it's the cause for the axial varicoses along the lower limb, or the cause of ulceration or change of color, or any change or any symptoms of long-term varicoses. So we perform the EVLA procedure for this incompetent great saphenous vein. The patient is under spinal anesthesia. The great saphenous is well located along its course. Before starting with the procedure, under total aseptic conditions, we perform a puncture at the great saphenous vein at the mid leg, and then we start introducing a sheath, and then after the sheath introduction, we introduce the catheter that is responsible for, or that is used for the ablation of the great saphenous vein. The introduction of this catheter is done under ultrasound guidance. Here we see that this is the great saphenous vein, here the saphenofemoral junction, and here this part, the echogenic part inside the vein. This is the tip of the catheter that's introduced for the ablation. After doing the ablation, after introduction of the catheter at the proper site, then we start pulling the catheter after opening, or after turning on the device that is causing the catheter to do the ablation. And then we pull it centimeter by centimeter till it's out of the great saphenous through the sheath again. But what are the precautions? The precautions: number one, the tip of the catheter should be at a distance of about 2 centimeters, not more and not less than 2 centimeters. There are some exceptions according to the surgeon or the interventionist that performs the procedure. So the tip, but ideally the tip of the catheter should be about 2 centimeters from the great saphenous and femoral vein, or saphenofemoral junction site. Then we start pulling out the catheter, but before starting to do the ablation and turning on the device of the ablation and making the catheter, not just the catheter but ablating catheter, then before doing that, we should inject tumescence, or inject saline, and it's better to be called saline, to be injected along the fascia, the great saphenous fascia, so to enclose the vein and to form an environment of isolation around the great saphenous vein, so to do spacing from the ablation side and from the heat away from the skin, in order to avoid the ulceration of the skin, and also to avoid the injury of the deep tissues like the muscles or nerves, or the arteries inside the muscle and underneath the deep fascia. So we perform isolation around the saphenous vein by using by injection of the cold saline. So what we see here is saphenofemoral junction, here the great saphenous vein, and here at this site, at the change of the straightness of the wall of the vein, here this is the site of the tip of the introduced catheter. What we see here at these the subcutaneous fat and at the fascia surrounding the great saphenous vein, we see there are anechoic lines. These anechoic lines are the injected saline. We inject saline around the great saphenous vein before performing the ablation, in order to isolate the site of ablation from the skin and from the deep structures. So what we see here is the great saphenous, where the great saphenous, it's not visualized properly because it's ablated, and what we see here is a echogenic echogenic focus, and this focus represents the catheter that is used for the ablation. I follow the catheter distally as I pull it centimeter by centimeter after turning on the device, and each centimeter is we use the power of the device for about 100 from 80 to 100 kilojoule per 1 centimeter, and for time of about 7 to 10 seconds, and then we start pulling the catheter gradually centimeter by centimeter through the great saphenous vein till total ablation of the vein is done. What we see here is changes of the fat because of the heat that is formed by the ablating catheter, and what we see here is the ablating catheter only, and we don't see the vein itself because it's totally ablated and it's thrombosed, and it's totally surrounding the catheter, the tip of the catheter, because it's totally thrombosed. We confirm that the thrombosis of the great saphenous vein by opening a color box, and we see no flow inside this great saphenous vein, and this is a longitudinal view along the great saphenous vein that is seen thrombosed with hypo or anechoic thrombus inside because of its acuteness and its acute thrombus. Then it's totally organized and chronic thrombus, and what we see is actually a echogenic cord, or we don't see even the great saphenous at all. We see here also the great saphenous, it's almost not seen. This is a residual lumen that is occupied by hypoechoic or anechoic acute thrombus. Here also we see the great saphenous veins that is transformed into almost totally echogenic circle that is representing the ablated great saphenous vein. Here we see air bubbles, and this is expected to be seen along the course of the great saphenous vein because of two causes. Number one, the heat that is formed by the tip of the catheter that is ablating the vein, so the heat forms carbon dioxide, and this is the what we see here is the gas bubbles. Also the injection of the saline here around the great saphenous vein course, that this may be a cause for introduction of some air with the injected saline. At the very last step at the procedure, we should, after removing the catheter, we should, number one, make sure that the great saphenous vein is totally thrombosed by color duplex. Number two, we should confirm the patency of the deep venous system after the procedure, because this is a complication known with the ablation procedure, that the heat causes not only the thrombosis of the great saphenous vein, but also the thrombosis of saphenofemoral junction and also the femoral vein, and this can be avoided by leaving a proper distance between the tip of the catheter and the saphenofemoral junction. Thank you.